Good morning. I'm Dr. Amy Baxter, and today I'm going to be talking about how to use Buzzy Pro, what the differences are between Buzzy Pro and traditional Buzzy, and in general, why vibration and ice are effective for blocking pain from vascular access, from injections, and from other needle procedures. So my objectives are to give you a spectrum of the FDA 510(k) indicated uses, the uses that have sort of grown up over time in the 22 years since we've been using Buzzy, and then a little background on the differences in the devices, and then when they are particularly useful from a time, cost, and extra benefits of the mechanism perspective. At the end, I will talk about the science of why vibration and ice work, and then finally finish up with some examples of how different companies have partnered with us to give their patients, their consumers, their customers broader access to pain relief. What inspired this was, as you know, the Infusion Nursing Society's 9th Standards Edition included vibration and cold as a level 1 recommendation for children and a level 3 recommendation for adults. There are 20 studies looking at the Buzzy mechanism for adults, but I do want to give a shout out that on the same day we heard the INS recommendations, we also were recommended for vaccinations in the American Academy of Pediatrics. As a pediatrician, that was a big day. So let's get started. What is Buzzy Pro needle pain relief? In the most simple terms, it is a combination of vibration and ice. Now, both of these are very specific and unique to this application. The vibration is a specific frequency that is triggering Pacinian corpuscles. What these are the position sense nerves. And just like if you bang your elbow and you rub it, there is a particular frequency that is causing the pain relief to happen. If you burn your finger and you stick it under running water, there is a particular nerve that is being triggered, and that is why the vibration frequency is very specific. In addition to that, the ice needs to freeze solid. So one of the things that is critical about using vibration mechanical stimulation to block pain is it needs to transmit with the frequency and the amplitude uninterrupted. In order to do that, we've created a very thin ice pack that freezes solid and calculated the thermal energy to ensure that it can't cause frostbite or problems. So how do you put these two things together? Well, first, you want to determine which side of the ice pack to put toward the patient. The blue side is the most intense, and the white side is a non-woven material that is going to be better for patients who have a sensitivity to cold, to give them a little bit of time to get used to it. They are strapped together. Now, this can be done with any tourniquet that you have in the office. We do include 2 straps that are specific for home use. So the orientation of the device matters, and we will talk about that, but you're going to place it proximal to wherever the procedure is so that the vibration is covering a blanket of area where the pain is going to be initiated. And the device comes with a carrying case box, 2 AAA batteries that can be replaced, but in order to make sure that it's tight enough that you don't have sound that would be annoying, there's a hex wrench to give it extra tightening, and it has 5 of the single patient ice packs. Now, these ice packs can be reused. We guarantee them for 100 times, but they can be used longer than that. The real issue is over about 3 years in a dry environment, they will dehydrate some. So it comes with the reusable single patient ice packs because they can't be disinfected because of the non-woven side, but they can be put into a bag and reused plenty of times. Now, the self-attachment straps. So these cannot be sterilized between patients. They are intended to make it easy for patients who are using the device at home for dialysis, for biologics, for them to be able to use it even if they have dexterity issues. So it comes with 2 of those. So when we started this, 2004 is when I discovered that ice and vibration together were effective. 2009 is when we launched, and we started with a bee. And the bee was specifically designed for vaccines. That was the intent. Very soon, we began finding patients using it for IV access. And subsequent to that, it was used for dental because vibration transmits really well through bone, podiatry injections, and then we had companies wanting to talk about starter kit inclusion because the biologics that were being approved for children were very painful, and the burn itself was also something that Buzzy reduces the pain of. So now there are 109, I believe, 110 randomized controlled trials or meta-analyses that have come out about the technology. And so everything from subcutaneous to even injections in dermatology have been studied. So Buzzy Pro came about because this was being used in the Netherlands for dialysis. And the people who were doing it for dialysis requested a bigger footprint of the ice pack and a bigger area and something that was faster to apply. One of the benefits of this, we also found quickly, was that in PRP or any injection which is being done with an ultrasound, the ultrasound probe is degraded by ethyl chloride. So if you want to maintain the $60,000 probe, PRP injections, that sort of thing, having a non-chemical way of blocking pain is important. The research also showed for children that the Buzzy mechanism is 3 times more effective than cold spray for pain. Infusions, lab draws, all of these are FDA 510K cleared and indicated with Buzzy and Buzzy Pro indicated to control pain. Now, people started doing non-FDA cleared indications. So to save time, it's been used for sclerotherapy and lasers. One of the interesting studies from Sweden found that the children who had been on chemo for over 6 months preferred Buzzy for their port access to EMLA. Not because it was better at controlling pain, it was slightly non-significantly worse, but because it was fast. They didn't want to wait an hour for the cream to work. And it's been used in France for lumbar punctures. During COVID, it was used not just for pain relief, but also to improve adherence for patients who either had problems with fainting or people who were afraid of needles and needed to have a mechanism by which they could get over that fear. So pump placement for glucometers or for involving glucose, continuous glucose monitors, and then for cosmetic tattoos, tattoo removal, and electrolysis. Any procedure that is going to take a long time. So anything where you're going to have multiple small painful things over and over again. And just to listen, hopefully we can, there we go.
I didn't feel that at all. Barely felt that one. Wow, that's a crazy difference. I'm hearing the sounds, but I'm barely feeling anything.
All right, so really quickly, how does this work? Let's talk about how pain works. So when you inject something, you're going to have that pain signal go on a very thin myelinated A delta pain fiber to the spinal cord, and then that is transmitted to the brain. Pain crosses over, all the other sensations go straight up. Now, when you have a myelinated fiber, what this means is that there's no electrical impulse that's passed, and it's conducted by sodium. So the ions in sodium are released and they skip along. So if you want to stop pain before it gets to the spine, then what we've typically done is used things to block that sodium from coming out. The intelligently named sodium channel blockers. This would be EMLA, lidocaine, Elemax. All of the canes are going to block sodium from coming out. The electrical stimulus is stopped. So the other place that you could block pain from getting to the brain is in the spinal cord itself. And in order to do that, to modify the pain signal while it's inside the dorsal horn of the spinal cord, if you put vibration and cold on a beta nerves that are the touch nerves and the C fibers, which are not myelinated, that's shown in orange, which is a cold fiber, those two things together in the dorsal horn cause the release of a neurotransmitter that stops the pain signals neurotransmitter from going up. Finally, one of the ways that you can override pain is to have the brain itself inhibit pain. So using something noxious like cold, that actually will send an inhibitory signal to the spinal cord. So those are the three ways that you can block pain getting to the brain. So this is why we say to put Buzzy between the brain and the pain. So here's what that means. So when you're orienting Buzzy on the person, the magic is coming from the motor and the vibration. Studies have shown in adults that 90% of the numbing effect is gotten by the motor. So when that 200 hertz vibration frequency comes out, in order to orient you to where it's coming from, we put a little indentation on the device, a little dot. So we say to put Buzzy between the brain and the pain and put the shot near the dot. On the Buzzy Pro, you can see that the side that has the switch, just like Buzzy, is not the side that has the motor. It's the opposite side where there is a dot. All right, so between the brain and the pain, you have to realize that the nerves that are coming out of the spine are going to go in straight line swatches called dermatomes. So if you want to do an IV access and an anacubital fossa, then you're going to put Buzzy Pro between the brain and the pain so that the vibration is covering that area where the injection happens. So when you're preparing for this, first of all, the ice packs need to be frozen about 30 minutes. You'll take them out of the freezer, decide which orientation the patient wants, whether it's more cold or less cold, then turn the vibration on. Now, this is a functional MRI of the spine. And what this shows with all of those red areas, that's where the neurotransmitter is coming out from activating with vibration. So unlike electricity, where you're going to get a very narrow spot, because we're using vibration, it's passing through tissues, we're getting a lot of different ones. It doesn't have to be extremely precise, but you're going to get better bang for your buck if you stay in the right dermatome. So again, you're going to put the shot near the dot. Two different ways of looking at it. So you put the device on, step 5, it's vibrating, it's cold, it is proximal, and this is important for IVs. You don't need to wait. You can just clean like you normally would and then do the IV access, the blood collection, the blood donation, the lab. You don't have to wait at all. So studies have found with Buzzy that in comparison with Elamax, for example, Buzzy took 4.5 minutes to get the blab drawn as opposed to 45 minutes. So just put it on, go, pain relief is there. Now, dialysis and intramuscular injections or sub-Q, where you have more tissue destruction and you've had tissue destruction in the past, those are going to require a little bit longer for the ice to work. So if we're going for someplace either on the deltoid for an injection, or if you're going to use this a fistula that is in the upper arm. So then what you do is you want to actually desensitize first and move it. So you put the Buzzy where you're going to be doing the cannulation or the IM, and you strap it in place, you can hold it in place, but it needs to be there for about 30 seconds. So the 30 seconds to 2 minutes, depending on whether the degree of pain. And then when you're ready to do the cannulation or the injection, you're going to slide the device up so that you can, step 7, put the painful part where Buzzy has just been. So Buzzy Pro is moved up, and then that is where you do it. So that's the area where you're cannulating. So to see what this looks like, here's a little speeded up. So the Buzzy is proximal now. It's already been in the space, but what you're going to see is that they're moving Buzzy up so that then the second cannulation is where Buzzy just was. So here's another option where the parent is holding the device proximal, and because it's an IV, they don't need to leave it. And this is someone who's doing their cannulation for dialysis at home. They leave it on for about 2 minutes. They do the first one distal, But then the second one, they move it up so that they can do the second cannulation where Buzzy just was. And it's actually big enough that you could put the two right next to each other. So you can put both of the cannula right next to each other. If anybody does have questions, I do have the question and answer open. So feel free to go ahead and use that. Now, so it's at home using the new strap. So what someone would do is they're gonna not keep the Buzzy in the freezer. Buzzy Pro is kept elsewhere. They're gonna get the long thing, and it has a hole in the end of it, so it sort of acts like a D-ring. So the blue side here, you can see it's being threaded through the ice pack, through the Buzzy Pro, and they're very, very large areas between the ribs to put that through. So then it goes through the hole that's in the end of the strap. And while holding the end of the hole, then the person is going to put their arm through like such, and then they can cinch it tight. So in this way, someone is able to put on a tourniquet one-handed. It's very difficult if you're by yourself to put on a tourniquet. So this is the solution that we've come up with so that these patients can tighten it and put it where they want it. Once it's in place, it sticks. And so then the person can move it proximal when they want to. So again, looking at the different places on the body where the unit can go, you just see that you need to know where the dermatomes are so that you can move Buzzy between the brain and the pain. And this is an interesting thing for dermatomes and PRP. So as you can see here, the PRP injection is going to go lateral to the side of the knee. This could also be a joint aspiration in rheumatology. And you would think, based on the way the arm positioning is, that Buzzy Pro is going to go directly proximal. In fact, if you look at this placement, and then you look at the dermatomes. So dermatomes are coming from the back of the spine. So in order to get to the front of the legs, they're going to curve around. So if that is the place you want, instead of placing Buzzy directly over the knee, instead it's going to go sort of lateral. So you can test this with a toothpick, you can test this when you're putting it on the patient, but understanding that when you're using something on the gluteus, or if you're doing it on the knee or the leg, it's going to have a bit more of a curve. Now, there is one possibility that because there's so many areas that it will activate, we have people, this is someone from Colombia, South America, Colombia, who has found that when he puts the Buzzy more medially in the shoulder, kind of where people are putting it for the port access, that he said in Spanish, but it every time it's miraculous, no pain. So there's a little bit more give around the dermatomes than we might imply with put the Buzzy, the pain near the brain, but there are different options. All right. So which Buzzy win? What are the different devices, and what's the difference between the original B and the Pro? The primary difference is simply that it's easier to thread and that it's got a bigger footprint. So the ice packs on the original Buzzies were either hooked on, or they go under a silicone strap. As we saw before, they're hooked on with with the strap threading through bigger areas of Buzzy Pro. Now, one quick word about vasovagal syncope. So a study that was presented at the Pediatric Academic Societies meeting in May found that severe vasovagal responses are reduced by 25% for HPV vaccines. We have actually found from our adult population that's using Buzzy for vasovagal for blood draws that the reduction in serious vasovagal syncope and in symptoms is much greater. Probably this is because the vagus nerve is wrapped all around the vein. And so Buzzy is a sympathetic stimulator. The fainting response is parasympathetic. And so when you're penetrating the actual vein itself, you're much more likely to stimulate the vagus, stimulate the parasympathetic. So Buzzy's sympathetic is blocking. All right, before I get to an answer, there's one other question here, but I will get to that later. So one of the reasons that people will use Buzzy is because the number of people who are afraid of needles has dramatically increased. If you look at the timeline, if you're born before the early 80s, we were not giving booster shots at age 4 to 6. And so when we started giving boosters at age 4 to 6, that's when kids remember. And that memory at a pre-logical time is difficult to overcome with logic. So this fear, particularly if the 4 to 6 year vaccines are traumatic, that's why now we have a hugely increased amount of needle fear in people who are younger than those born in 85. We actually found during COVID, when we asked people why they weren't getting vaccinated, only 16% said they were afraid of needles. But when we said, how afraid of needles are you, a little later in the survey, 52% had moderate to severe needle fear. So one of the reasons that Buzzy Pro came about is because people who are proud adults are embarrassed about having needle fear. They don't want to admit to it, and they certainly don't want to be. So that's one of the reasons why we made Buzzy Pro. Same motor, everything inside that is exactly the same. The efficacy is the same. It's just that it doesn't look like a bee. So looking at the comparison of when you would use the different things. So these are the current comparators that are on the market. So there is cold and ice, there is Elamax, which is a 4% lidocaine, EMLA, which is half prilocaine, half tetracaine, and distraction cards, and then Buzzy. And so the distraction is using cognitive anterior cingulate cortex. Totally different lecture. Watch the TED Talk, how your brain hacks pain, if you want to see it, understand why that works. But what you can see here is even before we had an additional 20 studies, there really are no studies at all on injections and liposomal lidocaine. So this is not, liposomal lidocaine is not cleared for injection, so you cannot use it for that. People do, but it's not FDA 510K cleared, and there's zero data. There is no data for 30-minute creams. There's only 2 studies for EMLA, and in older children, it does not work. The only studies where it showed a difference were very large studies in infants. So if you're looking at this for an injection for an IM, the only thing that does have both adult and pediatric data is cold and vibration. And for IVs, it's significantly more. And the studies show, depending on the study, some non-inferiority when it's used with the ice pack, and almost equivalent pain relief when it's not used with the ice pack. From a cost comparison wise, Buzzy Pro is actually $150, but it comes with 5 of the ice packs. And again, you can use it for 400 uses with the batteries it comes with. They have a 20-hour battery life. If you replace the batteries, then the cost becomes negligible over time. All right, so looking at why ice reduces pain, we've gone through this, and the ice part is something that is different. So the ice is called descending noxious inhibitory control. So it's also called conditioned pain modulation, but the idea is that the cold that's transmitted on that middle non-myelinated part, that is perceived in the brain as unpleasant but not dangerous. So then the periaqueductal gray, the areas within the brainstem itself, are going to inhibit pain coming up. So how much do you get from ice when you're doing this? Well, as I mentioned, with IV access, Amadine et al. Found that the vibration was 90% of the pain relief, and the ice only added 10. When you're doing something more painful, between 25 and 50% of the pain is reduced with this descending inhibitory loop over time. So this would be for your sub-Qs, for your more burning injections, or for dialysis. That's where we do recommend using the ice, because you're going to get a bigger bang for your buck. All right. We have about 4 minutes left. So I'm going to run really quickly through the spinal gating neuromodulation concept, but if you have questions, please put them in now. One question is PRP, that's plasma injections into joints to stimulate growth and decrease inflammation. All right, so what we know now about gate control theory, which is called spinal gating in the literature, is that actually the 1965 theory that you had modulation happening within the dorsal horn in that circle place, that has been refined in the late 80s, early 90s to know that what is actually stopping nociceptive pain, that sharp pain, is the Pacinian corpuscle, and it alone is going to release the neurotransmitter to block pain. So when it gets up to the dorsal horn, all of these different mechanoreceptors, so touch, stretching, everything else, those are going to go into a wide dynamic neuron, a wide dynamic range neuron. Those actually are not found to consistently block nociception. Some increase, some decrease, some are biphasic. But the only thing that will consistently decrease the nociceptive input is this Pacinian. All right, so how do they know that? Well, in the A delta pain fiber and the C fibers and all these others that are coming up, so a guy named Mike Salter anesthetized cats, all but two. And then what that did was it stopped that descending inhibitory control. So they could really look and see by cutting the spine at L5 or L1 and then cutting again at L5, they could actually put a probe into the neuron to see when it fired. And what they found was that if you put all these other touch sensations around the place where pain was, you could get increased firing. But when you put vibration distant, and in this case it's proximal to, but if you put vibration between the brain and the pain, the nociceptor that they were looking at completely stopped firing. So what's happening is that the vibration is causing in the dorsal column release of adenosine, it turns out, and adenosine denatures the ATP, which is the signaling from the nociceptor, and so it presynaptically inhibits the crossing over of the pain signal to go up to the brain. So this is the adenosine blocking it, and so the nerve that is supposed to take the signal across the spinal cord and up to the brain doesn't get triggered. So is this distraction? We get asked. No, these are anesthetized cats. And part of this research also lets us understand that any vibrator is not necessarily going to work. There's going to be a decreased effectiveness of it until you get to the right amplitude and the right orientation and the right frequency. So all of these things matter. And the vibration, as we mentioned, is also shown all over the spinal cord. So as opposed to an electrical stimulus, which we often get asked, the natural touch stimulus or the stimulus that comes from a brushing or a vibration, those are the ones that are going to be scattering neurotransmitter all up and down about 4 vertebral lengths. These are just oops. So some of the ways that we use that we partner with people. When we initially started, Quest Diagnostics requested we make an OEM version. It was extraordinarily cute. It was cuter, called Quiggles. I'm sorry, Buzzy, but I think it is a little cuter. And then the other companies have used different mechanisms for how they wanted to get the devices to patients. Because they're a 510(k) cleared device, they are a medical device. They're also not a combination device. So they don't have to be tested with any individual drug. It's the painful procedure. It doesn't matter which drug you're using. It's the same A delta pain nerve. Pfizer gave them out in Australia for their patients with hemophilia. We have Roche, we have Grifols, we've got multiple other companies that in different areas of the world will give them out. And there's different ways to do it. So some will use the device and put it in a starter kit. So this is perfect if you've got a very painful injectable device that you're having trouble with your patients being compliant with. So rather than having a whole bunch of different things, just having the opportunity to get Buzzy Pro, Buzzy, Lady Buzz, any of the devices with the prescription for the medication itself. Now, others, here, she's got a cute little quote, but we don't have time. One of the things we've also done is spent about 10 years researching what the optimal starter kit is. And so we actually have different models for starter kits with different mnemonics, the ways that you need to organize a kit optimally that fit with the rheumatologic research that's been done on what patient preference and adherence is. We've had family offices that have purchased the devices to give away. So this is something that is good if you've got a charity that's involved. One of the other companies had this be it part of just like requesting a Sharps box that you could request the device as needed. So on behalf of my inspirations for the pain management and relief, these are the little guys that got it started, and they went from being afraid of needles to no longer being concerned. So thank you. And I'll tackle some questions really quickly. This will be available for those who have registered on a YouTube link. So do you have to use the ice is a question. And we get this a lot, and it will work better. You will have better pain relief. The research that shows that it is equivalent to LMAX, non-inferior, and works as well as EMLA, those are all done when ice is used. When ice is not used, you're going to have a slightly 10% decreased pain relief for IV access, and the pain relief may be as much as 25 or 50% reduced. Yes, they're actually in Canada. We do have AHS is our distributor in Canada. So I believe they should be available on Amazon Canada and the Buzzy side, and then Buzzy Pro. Yes. I'm hoping that Jennifer Tipping, who's in our Q&A section, may be able to answer. But yes, we are. Health Canada has graciously agreed that because we are not changing tissues with energy, we are merely leveraging the body's own energy to decrease pain. Health Canada has granted us a class 1 level. So Buzzy Pro is available this year in Canada. It seems like they're not quite yet, they're not available now. Buzzy itself is available. We have on the Pain Care Labs website the chart that compares Buzzy Pro, Buzzy, and the XL Buzzy and the Mini Buzzy. So the biggest difference is just that if you are looking at the two devices, I'm going to stop sharing the screen so I can answer the question. If you look at the two devices, the motor is the same. The size is just a little bit different on the back. There's just a little bit wider area of footprint. And then, of course, the ice packs. This was the thing that the people doing dialysis, they wanted a bigger footprint. So this footprint completely is covered by the vibration. So all of this plastic is giving the vibratory signal because vibration is transferred beautifully through solids. So this makes the entire area of the ice pack distribute the frequency that blocks the pain. Ashley Curry, there is a international at paincarelabs.com. If you can, I don't know if you can see the Q&A. Any other questions? So if you go to paincarelabs.com, we have, we have Buzzy Pro. The musculoskeletal implications of having the vibration for pain relief, there's actually a lot of additional benefits. So we have other webinars that talk about the treatment of pain from muscle tension and muscle restriction, because vibration also increases blood flow. Vibration has cellular level effects on decreasing the development of fatty infiltrates. It makes muscles recover faster. It actually is bone and muscle stimulating for growth. So a lot of additional benefits. You can look at those, and thank you so much. I've got possibly 2 things in the chat. Oh, hello from Kuwait. We are in 28 countries and growing. And thank you so much for coming to our webinar. One last call for questions. I'd actually told people I would stay on till 8:45. So we do have a distributor in Kuwait for the Buzzy devices. If you will, again, if you will email if you will email international@paincarelabs.com, then we can get you the information about our distribution in Kuwait. I'd love to know, Kuwaiti, are you in one of the hospitals? I actually lectured at the hospital in Kuwait for procedural sedation, pain management, maybe even child abuse, about 8 years ago, and met some lovely physicians. You're very welcome, Ashley. One other fun thing, we do actually now have posters that you can place with your Buzzy Pro. And we also have these really cool, there we go, got pins that have immediate training on them. So you want the VibraCool for the post-op pain or the Buzzy, and we've also got Buzzy Pro posters that will now be coming with the Buzzy Pro devices. All right, oh, here we go, wait a minute. Do we have a distributor and cutter? Yeah, we're actually in discussions right now getting a distributor and cutter. So Jay, please, again, contact us at Pain Care Labs, and we'll find out, at least be able to stay in touch and let you know when these are available there. Are there any other topics that you would like to see more of in future webinars? Likewise, if you want to put in the chat what a good time is for your country or where you are, that would be useful for us to know. What we're trying to do going forward is to have 2 different webinars, or the same webinar at 2 different times, so that people who are in different time zones have an opportunity without waking up at 2 in the morning. I know in Australia and New Zealand right now it's 2 in the morning, so sorry about that. All right, well, I think at this point we have gotten all the questions we're going to get. Thank you so much for staying on, and we will be sending you a copy of the webinar when it is available on Zoom. Take care and thank you.